Prof. Benyoa, University of Science and Technology from Algeria. Is he? Okay, very good. I hope I pronounce your name correctly. Thank you. Yeah. Do we have Dr. McCoy? Thank you. Do we have Dr. Mahali? Dr. Mahali, can you hear us? Are you online? Dr. Mahali? Okay. Can I get confirmation whether I think this Miss Elizabeth Kambonde. Elizabeth Kambonde is not here. Okay, maybe still coming. Can I get a confirmation whether Prof. Fumulani is here? Thank you. And then the last one, I don't know if it's a Mr. or Miss or Doctor, but it's Justina Malandela. Is he or she maybe online?
Hello?
Yes. Can you hear us?
No, this is Alude Mahali, the previous.
Is it Malandela?
Sorry. No, I'm not Zina.
It's Mahali.
Yes, it's Mahali here.
Okay, thank you. I just wanted to indicate that how we're gonna do. We're gonna start with the people who are in the room, and then we'll move to those who are online. Okay? So,
Chair, can I just say I have a hard stop at 1 o'clock.
Sorry, your voice is dimming. Can you say that again?
I said I have a hard stop at 1 o'clock because the program has run late.
Okay.
So I'm one of the online people, so it'll be difficult for me to wait beyond 1 p.m.
Okay, so I will ask the colleague here, are you fine if we can let her start? Thank you. So, Dr. Mahali, we are going to start with you. Please say your presentation. You have about 6 to 8 minutes.
Oh, okay.
Yeah.
Chair, is there an IT person in the room with you? Because it seems like my video is disabled. Are you seeing me at all?
No, we cannot see you. We only see partially.
Is there any technical assistance in the room to figure out what's going on? Because I'm concerned, even if I try and share my presentation, will you be able to see it? I'm going to share now. I had asked Caiaphas to share the presentation from his side or from the conference side.
Just share it. I think we can see it.
Can you see it?
Yeah, just put it in a presentation mode.
All right, it just makes it a bit difficult because I don't have my notes. Just give me 1 minute, colleagues. I would have liked to switch my video on, but it doesn't seem that it'll work, so it's fine. I'm going to try and turn up my volume so I can be nice and loud. Good morning, colleagues. I wish I was there in Namibia with you, but sadly that wasn't possible. I'm joining you today from a rainy Durban in South Africa to talk about this experimental pilot intervention that we did this year. And some of the motivation leading up to this to this intervention was this question here in this COP26 poster. Where is the Global South? Where is the Global South in these global discussions about climate justice, climate action, and environmental sustainability? Also, I'm sure we all remember this picture from 5 years ago of these young climate youth activists gathered for a summit, and this was sort of the rise of Greta Thunberg. And then you have Vanessa Nakate, a young climate activist from Uganda, who was there with these fellow Global North colleagues, but in the reporting, in the press, and the media, she was cropped out of the photo, further sidelining the voices of the Global South, and in particular young African people in the global discourse of climate action. My colleagues, some of who are in the room with you there, Wilfred Lunga and Kaifas Baloy, wrote this amazing article that came out recently that really injects fire underneath our bellies in terms of the urgency of climate change education and preparing African youth for future challenges. So taken together, these three charges, that call of where is the Global South from that COP26 poster, the sidelining of very active young environmental activists on the continent, and the urgency for climate education lead us to the Theatre of Climate Action, TOCA. This intervention we did using theater to amplify the voices of Global South youth. And it's a way of doing non-formal youth-led transformative justice education to kind of improve the skills, capacity, and agency of young people, to involve young people in knowledge about climate justice, and to use creative and artistic methods to do so. Also to generate cross-community dialogue across Guadeloupe, in the Caribbean and South Africa, and knowledge exchange amongst creative practitioners and young people in ways where they can directly speak to climate justice and how they connect to their own contexts, but also to global contexts of gender, race, coloniality, intersectionality, and ecological politics. So the key literature undergirding our study was certainly a decolonial ethos, a feminist ethos emphasizing relationality, participatory action research, particularly youth participatory action research, that takes research project from being mine, the researcher, to ours, the participants and the researcher, to eventually theirs, where they have complete ownership over the work that they produce. And we use participatory theater. But the theory really undergirding our intervention was the Safer, Braver, Riskier Spaces framework, which is informed by the Safer Spaces framework methodology from Platonique, practitioners that work on sort of co-creation and collaborative knowledge creation, and Bustamante Duarte et al., who talk about safer spaces, and Ricard and Villarreal, who talk about brave and riskier acceptable risk spaces. So just quickly, Guadeloupe is a small island in the Caribbean. If you don't know, they're, at the height of climate crisis with rising temperatures, sea levels, hurricanes, earthquakes, all the things that come with being an island, a tropical island. And then, of course, environmental issues with the chlordacone scandal, where 90% of the island's population have chlordacone in their bloodstream as a result of being used in the banana plantations. And society has responded with vigor across the island to this current sort of neo-colonial environmental injustice, and really the grip and hold that mainland France continues to have on the island. So even when we were recruiting, the island and the neighboring island, Martinique, were really at the height of protest. Similarly, too, in South Africa, we have our own rising climate harm issues and energy issues. And what we are seeing, though, is a rising coalition of young climate activists that bring together gender, racial, immigrant, economic justice, climate justice together. So it's really fertile ground at the moment. And we had these young people come to an information session about the program and tell us why they want to participate. And it's everything from feeling like they're activists to to the knowledge that they are having no conversations and activities that talk about the climate crisis in their own context, but also realizing the power of theater to address complicated structural issues. So these 8 young people in Guadeloupe, 8 young people in Pretoria created, designed, and performed theater pieces that reflect their exploration of climate justice. They came to monthly in-person workshops to create this work, facilitated by creative practitioners, guided by them, incorporating different participatory visual methodologies, lectures, dialogues. And then also there was cross-country interaction, transnational interaction with online workshops, guest speakers, including, for example, one time an environmental lawyer, and so on. And through this, they were able to develop their skills in storytelling through theater, but also articulate their own political responses to local and global climate issues. And these stories will be amplified beyond this project. And so in the end, we have 2 scripts and 4 performances that we recorded that we're able to use for further dissemination. I think it was really great that we were able to have this expression of interest because it gave us a sense of buy-in and commitment, but also had these young people really think about how does this issue affect me in my life and what do I want to say about it. But we also had complications and difficulties that I won't go into now. Maybe if we have Q&A, we can. Just to put you in the world of what we did, our first workshop, these are four for half-day workshops, 4 or 5 hours with a bit of a lunch break. Young people come together, they do icebreakers, get to know one another, set the intentions of what they want safer, braver, riskier spaces to be, watching a short documentary, creating together a climate justice glossary, you know, from A to Z, what are the important terms and what do they mean to us? And of course, understanding the world of the project. And you see there with the pictures, they'd already started to create not only their notes around how we wanted to operate, but also kind of using found objects to already start to create props for the production. So 3 quick headline findings are that bravery, safety, and acceptable risk can be understood as co-constitutive of each other. They didn't place risk, bravery, or safety on a hierarchy, but recognize that all 3 are important to work in this collaborative way that can be uncomfortable, that is a bit controversial, particularly in the Guadeloupe context, where even the government was questioning our project and why we're doing it and who's the HSRC. And so the young people recognize that all these things operate together. Key 2 was learning to choose to work with bravery, safety, and risk as key architectures of a collaborative space. And that also means you have to choose to center affect, your emotions, your feelings. They come out quite strongly because for many, the threat is very real, particularly for our young co-creators who are living in township contexts and informal dwellings, being victims of floods and so on. One of the co-creators says, feelings may lead us to and through our universe, our vulnerabilities. And so being able to have freedom of expression, feeling at ease, feeling a comfort zone was really important to creation, but also not denying the importance of materiality, particularly for our Guadeloupe co-creators, recognizing the global context. You hear them saying, you know, I feel secure when I receive my payslip, when I meet my principal needs, when I'm at ease without struggling financially. And so part of this project, it was really important for us to even give our youth co-creators a stipend. And we felt really happy to be able to do that. They affirmed, these young people, the dynamism and relevance of the youth voice, agency, decolonial perspectives, and climate change. And this was important, especially that they're often sidelined, you know, in favor of northern perspectives. We also were able to see that climate justice and climate coloniality rhyme across space. Even though these are 2 different locales, histories, young people found crossover themes and power relations that speak to both contexts, which was really important. But also, this project is about destabilizing and busting myths that young people are apolitical or that they're not able to drive political conversations. I think the methodology and the medium is what's key here. So in the end, our young people created Mangrove Kairi in Guadeloupe and Are We Worth Saving in South Africa, and which were watched by hundreds of people. And we have these amazing videos that we're going to continue to disseminate. In fact, there's a screening in Nottingham, UK in the coming weeks, which will have dialogue with these productions. But it's evolving work, it's difficult, it's about time, resources, and access. access, excuse me, but we do have these 2 scripts and performances, and we want to continue to apply for funding to grow the work. So just a quick thank you to my team. To wrap up, Paco Major from Artline in Guadeloupe, Dr. Christina Johnston, especially at the University of Pretoria, and then my 2 collaborators, Dr. Dena Arya and Dr. Lydia Hiraide at Soka University and University of Nottingham, and of course the Feminist Centre for Racial Justice at SOAS, University of London, for funding this project. There's a podcast on the project available, and the videos and many photos and other kind of background information on the project website, which I'm happy to make available. Thanks, Chair.
Thank you, Dr. Mahali. Very insightful. Theater of climate action, youth voice, 2 important words there, but also bravery and safety. But we also highlighted a very important feeling secure, especially the issue of financial security is a very important. Maybe that is also, I was thinking to say, financial issues also maybe why decolonialization and actually why decolonization is very difficult because you are trapped in there. So thank you very much. I just want to know if there's anyone who has a quick question. I'll allow about 3 questions to Dr. Mahai in case she need to leave because she said she need to. Yeah. Any question or comment, reaction?
I'll stick around still for an hour, Chair, so if there are any questions later, I'm happy to take them.
Okay, thank you, thank you. Yeah, maybe I just have a quick question. You are talking about theater here, and then we were now talking about the University of the Village or whatever. How do you link, because my understanding of the theater, and how do you link this to the University of the Village?
Sorry, Chair, I might have missed the context of the University of the Village. If you could fill me in, maybe I can respond.
Yeah, yesterday we were introduced to the concept of University of the Village, to say where we come from, that's where the learning starts. And where we come from, I'm also sure that there's theater. How do you link this back to where we come from? That's the gist of my question.
Yeah, I mean, storytelling is, a centuries-old tradition. Absolutely, it's an indigenous knowledge right there. Living and breathing indigenous knowledge is through storytelling. So we have a rich tradition of that as Africans. But as South Africans, we have a rich and even richer tradition of protest theater. That's really where our tradition of theater has grown out of struggle, has grown out of speaking truth to power, has grown out of trying to destabilize the status quo. So it's very much embedded in our history to be able to tell stories through theater, to be able to fight through theater, to be able to articulate politics through theater. So it's really just a return to who we've always been, storytellers, though undocumented, and people who agitate for change through creative means, and in this instance, theater. So I think this is only growing on that, and I think adding that transnational perspective from the Caribbean island and seeing so many points of connection only emphasize the importance of South-to-South dialogue, South-to-South collaboration, and more of these transnational explorations, because there was so much synergy in what the young people had to say. across these contexts, not even understanding one another, since, you know, our Guadeloupe participants were mainly French speakers. And I think that's why it's so important to use arts-based methodologies that go beyond language, that transcend language, and that in which you're able to, within safe bounds, be brave. You are allowed to criticize, you know, the state, criticize the current position in ways that, you know, you use symbolism, you use metaphor. So in some ways you protect yourself, you know, than your standard sort of protest or activism where you're on the street. So it's kind of a clever way, I think, of making the personal political, and showcasing that on a broader scale. Sorry, I don't understand. I didn't fully grasp the concept of the universe. I mean, I think I do when you explained it. So yeah, I hope that speaks a little to that. Thanks for that question.
No, you did it very well. Thank you very much. I see there was a hand here. Is it pressing questions or? Yeah, there's one hand here, please. Who's handling the? Yeah. Briefly, please, because of the time. Yeah.
Okay, thank you. My name is Ernest Marange. So I'm reflecting on the picture where that other girl was cut out. And my question is, what then, is there any capacity building that is being done, especially for the marginalized community, so that they also can participate in this theater and also express their views? Because these happens to be the people that are mostly affected because they live day to day with these issues of climate change. Thank you.
Thank you very much. Dr. Mahai, did you get the question?
I did, yeah. I mean, to be honest, thanks for that question. I think the issue also is we don't know enough about what our own young Africans are doing on the continent around climate action. And to assume that they're not doing anything is, I think, really dangerous, because we are a continent characterized by informality. We are a continent characterized by Jua Kali in Kenya, by Kanju in Nigeria, you know. And so I think young people are finding ways of articulating, but also combating the climate crisis. But I don't think we've done enough work, research, either empirically or even you know, in scholarship, to understand the nuances in the different regions of our own continent. So I think that's our first point of call is, what are young people doing? You know, in making livelihoods, in groups, in community. I think that's the work that needs to happen first. We know a lot about the global north. We know a lot about these activists. We know a lot about the co-ops, the coalitions, but I don't think we know enough about all the amazing work being done on the continent. So we need a synthesis, an evidence synthesis of that. Because who knows, maybe there are young people who are already doing theater in community around different issues, climate action being one of them. So I think that's a first point of call.
Thank you very much, Dr. Mahai. Thank you very much. We want to encourage you to really continue with this work. Please continue with this good work. Thank you very much.
Thank you so much, Chair. I'm going to stick around for an hour and listen to the other presentation.
Very good, thank you. Let's scrap her. There was also a request we have to apologize to you, Prof. There was a request of a more related topic. Prof. Mulani, if you can come forth to talk about co-developing climate adaptation strategy in semi-arid environments.
Good, still, yeah, just the afternoon. Good afternoon, everyone. I am Pumurani Matiba. I'm from the University of Limpopo in the Limpopo province of South Africa. And I am here with Dr. Matimulane, who works for the HSRC, but I see he might have stepped out. So I'm here to talk about co-developing climate change adaptation strategies, and this is a case study that we did with communities in the Waterberg District municipality, mainly focusing on the Mukolo as well as the Lipalale River catchments. So this is much of a broader WRC-funded project. So South Africa has been characterized as a semi-arid environment, and mainly because of the rainfall characteristics that we see in South Africa, which is well below the world average of 900 millimeters per annum, I think, whereas South Africa, we only receive about half of that at around 450 millimeters in a year. And one common thing that most of the SADC communities experience is it's this frequency and occurrence of drought and floods and heat waves. And when we talk about climate change, we see the magnitude as well as the frequency of these extreme events happening. And this has implication on water security. And this gives rise to the need for localized climate change adaptation in order to meet that water security. So in terms of our research objectives, so the main aim was to co-develop context-specific implementable climate change strategies, adaptation strategies for those two catchment areas in the Waterberg district. And then we adopted a mixed method approach. Because this is much of a bigger project, there was also a detailed climate change data analysis that was done, where we analyzed rainfall, temperature, as well as get drought as well as flood cycles from those data. But then this part, we focused on participatory stakeholder workshops where we were trying to come up with those adaptive strategies given how the climate is going to change in the coming future. So there was several stakeholder consultation over a series of 3 workshops that we did with this community, and that was our co-development process. So the map there is just showing in context where these two catchment areas and the Waterberg District Municipality it's found. So in terms of the methodology that we approached, like I've indicated, we had those 3 series of workshops where there was engagement in terms of there was actually a questionnaire that we drafted, which was presented to the different stakeholder groups that were presented. In the next slide, you will see the different stakeholder groups that we were interested in. And we used an Excel-based spreadsheet, which is a multi-criterion, which focuses on multi-criteria decision analysis. And this is a climate prior Excel spreadsheet, wherein the data that we collected through the questionnaire, we will load it onto that spreadsheet, and we will do some analysis on that spreadsheet. And then that's where we end up with different climate change adaptation options. And then we synthesize them, and then we reduce them to a number that was most preferred in terms of the ranking process. And this preference was mainly given by the different stakeholders that were present in those different workshops. So in terms of the different stakeholders that were present, we had community members from the two catchment areas, the Mukolo and the Lapalala. We also had decision makers at community levels, and here we are talking about the headmen, the ward councillors. We also had representatives from the municipality. We also had what we call scientists, where they have where they are more like experts in terms of climate studies. So this is just showing, these pictures are just showing the proceedings of the 3 workshops that we held. And then in terms of key findings, similar with most areas in South Africa, It's a summer rainfall region. The majority of South Africa is a summer rainfall region, except for the areas around the Western Cape. And then there's also a high variability in terms of rainfall. And we have also seen that the timing of rainfall has also changed over the years. So in the block on the right, it shows the ranked adaptation options in terms of what the different stakeholders that were present in the workshops mostly preferred. And this involved environmental conservation, water pollution prevention strategies. So these are what they think are feasible within their own local context. And I should state that I remember there was one guy who was very particular in terms of we need to protect the environment because that is where we derive all these ecosystem services. So this is just showing one of the radar, a spiderweb representation in terms of the normalized data, and all the climate change adaptation options that were raised had a score that was closer to 1 when we normalized it, and this showed that this was the most preferred options by the different stakeholders. So this is the graph on the right. It's showing in terms of that first box I showed you with options, they scored that from 1 to 7, and we can see that there is information sharing between the different sectors. Because one of the things that came out was that myself and the rest of the project team members were there, and some communities were like, there have been a number of people coming here, and you seem to be doing the same thing. So there was a big sense of scientists and researchers and non-governmental organizations doing a lot of work in silos. So information sharing, they indicated that this could be one way, instead of repeating things, that we can actually derive benefits of whatever it is that you're trying to do. There was also a big emphasis in terms of water use efficiency and water conservation because of the heightened drought risk that these areas are currently experiencing. So in a nutshell, in terms of what they deemed implementable from the list that they have indicated, most of this were feasible within the short to medium term plan, such as your law enforcement, especially these are environmental laws. They've indicated that if the strict enforcement of this environmental law, for example, dumping things along the river banks, for example, which will eventually be carried into the river system during rainfall seasons, they indicated that there should be a stricter enforcement of all those kind of policies and rules around their various catchment areas. And then there was also a strong emphasis on environmental conservation, prevention of water pollution, as well as an adoption of destocking, especially around drought periods. And they also took into consideration what will be the cost of implementing this plan or these coping strategies. Some of them you can see there's nothing that they indicated that will be very expensive within their local context. Most of them were low, and you can see that in terms of law enforcement, they've indicated that the cost of that will be a bit medium, whereas in terms of exploring groundwater as an alternative source, they've also indicated the relative cost of that as medium, and this is mainly because of the drilling of boreholes that has to be done. And this, they've indicated that it's not possible only to be implemented by the community, but they should be the municipality involved as well, both the district municipality as well as the local municipality, because at a village and community level, they may not have the financial resources, for example, for drilling boreholes. So the implementation plan, like I've indicated, mainly it's medium, it's short to medium. And then the key insights that we got from there is that there is really at community level, and this is something that mainly scientists do not consider when we are doing projects, is that there's a lot of imposing things on community. So what we found through this is that there's a very strong community ownership in terms of the last slide, the plans that they think are doable within their context. And there is weak institutional support from both the local and the district municipality, and this trickles to poor service delivery. And then that top-down approach, the people that we engaged with have indicated that it does not necessarily always work. So in terms of local municipalities are central because they are the ones that will end up implementing some of these policies in conjunction with the community, and then not only top-down should be considered, and maybe an infusion of top-down and bottom-up approaches, then that can derive the resilience and we can start realizing the actual impact. In terms of recommendation, mainstreaming participatory adaptation into policies, not only looking at what we are doing at a much higher level, but including at community levels. I know in South Africa we have something called public participation when we are formulating environmental assessment plans, but how impactful is that, and is that followed according to the policies and how it's supposed to be implemented? There's also the enhancement of district data and monitoring system. Building capacity is very important because there are a lot of young people that are interested in decision making and in protecting their environment. And then obviously let us avoid working in silos, but let us come together and work together instead of all of us doing things in our own little corners. And then I would like to acknowledge, like I've indicated, the Water Research Commission, which funded the much bigger project. The two universities where I'm from, the University of Limpopo as well as the University of Venda, the Human Science Research Council, the La Palala Wilderness School, and the Waterberg Biosphere Reserve. They were quite instrumental in helping us mobilize the different stakeholders during the workshops. Thank you.
Sorry, Prof, for pushing you. Time is one of the very scarce resources, so we have to fit everything in the time we have.
No problem.
But thank you very much. I just want to allow two questions. Yes, Prof? I'll start with him, and then can someone help with a microphone?
Thank you very much, Prof. Mativa. I think it's a very interesting project, especially given where it was done. But my small question is, given the centrality, I think your conclusion seems to suggest that local municipalities are very important in terms of implementation. So my question is, in your initial mapping of the critical stakeholders who should participate in your core development of these adaptation strategies, was there any specific reason why you left them out? And you only focused on the community. That's just yes.
Okay, thank you very much for that. The municipalities were invited. The Department of Water and Sanitation Provincial Office was invited. The municipalities did come, the municipality representative did come to the first workshop, but I think it got a bit heated with the communities and they never attended the last two workshops.
Thank you. Yes, Prof?
Thank you. You said one of the adaptation strategies was de-stocking. So how does it work? You know, I know in those semi-arid areas, people keep a lot of livestock. So how do they de-stock?
Mainly, one of the local members indicated that they will sell them off because there will not be enough food as well as water. So most of them will sell them will sell them to the butcheries mainly around there for meat. So that is the main thing that they indicated that they do in terms of letting them go or reducing the number in order to keep up with the scarcity of water and the food.
Thank you. I have to, I know you're his agent, but I think we can discuss later on that. I need to move to the next presenter. Thank you, Prof. Oh, thank you. Okay, the next presenter, Prof. Dino, yeah. Prof, he will be presenting local knowledge, continental value, traditional seismic risk reduction techniques in Casbah of Alger and its relevance for Africa. Okay, your presentation is not yet on the system. Can we move maybe to the next one while you are setting that one? Okay, thank you, yeah. Is Prof. McCoy ready? Thank you. Prof. McCoy will be presenting about the effect of global shortage of outdoor disabled syringes during the pandemic of health security and childhood immunization in Africa.
8 minutes, and good afternoon, colleagues. You might be wondering, what is this topic doing here? How many of you know syringes? Yes, a good number. And how many of you know that syringes were a critical component for the pharmaceutical response to COVID-19? Okay, so this story that I'm going to tell you this afternoon is about the fact that these devices, medical devices called syringes, were part of the bigger response to COVID-19 when the vaccines became available. So it is critical that future generations are protected from large-scale catastrophic events affecting societies that are caused by climate change and pandemics, such as COVID-19. And there is literature that is already emerging that the two, climate change and possible pandemics in the future, must be looked together, and strategies for responding and preparing for pandemics and climate change must not be divorced from each other. So this is the understanding that we have for this work that is evolving. Vaccines became central to the pharmaceutical response to COVID-19, and COVID-19 disaster response basically disrupted routine immunization. And when we talk about routine immunization, we are talking about those immunization programs that children are taken to have immunization, to be vaccinated. And every country has its own schedule, and every country is supported by the World Health Organization to deliver on its own schedule. And this is a program that has been implemented in different countries in the world, mainly UN member states, but particularly those that are members of the WHO. And it is an old program when we take into consideration that it is now into its 5th decade. And vaccines administered from birth, when a child is born, throughout childhood, they build immunity. Not just immunity for a child who is vaccinated, but also for members of communities because of herd immunity that is developed in the community. They save lives, but also strengthen families because they help families to avert illness and disease, and most importantly, disabilities that have been common in the absence of these interventions. So, in 2019, when COVID-19 became a problem for the world, and as time moved, you remember that we started with the non-pharmaceutical interventions that we were subjected to by our governments, and over time, the pharmaceutical response matured and vaccines became available to most countries in the global north, but in the global south, particularly in Africa, we did not have much access as you look at the statistics that indicate how many of us got vaccinated. But what is important is that at this point in time, the pharmaceutical response to COVID-19 temporarily shifted the normative values that are based on global solidarity in addressing health challenges and prioritizing the needs of vulnerable groups, particularly children. Perhaps this is the first time we talk children in this conference, and some of us are activists, and we are activists on behalf of children. And so routine immunization was vastly disrupted during this period. And at the end of the pandemic, or towards the end of the pandemic in 2022, we found that 67 million of children were either zero immunized or they were under-immunized. So there was a problem of these children, a big number of them, who were not going to effectively contribute to the herd immunity that is required. And we know that the biggest risk of that is outbreaks in communities. And we have already seen some of them who have experienced measles becoming a problem for different countries. So the research objectives, the first one, to explore how the pharmaceutical response to COVID-19 pandemic impacted on routine immunization of children in Africa, looking at low and middle income countries. And there's a reason for that particular segment of countries. To explain the links between the long-standing global health policies on auto-disable syringe, that is manufacturing, distribution, supply chain use, and routine immunization of children. And lastly, to understand the role of syringe distribution on children's routine immunization and links to pandemic response. And what does the literature say? The literature, what we see is that when we look at the factors that are responsible or are identified in the literature as responsible for under-immunization of children during the pandemic, there are many. And we find that they are framed around the concept of the pandemic being a health disaster. But children were not as severely affected by the pandemic as adults. That we also experienced, and it's coming up clearly in the literature. There is an indication that in terms of infections, but also in terms of severity of symptoms, adults were more affected than children. And also what we find is that the children's health was affected by the non-pharmaceutical responses that were put in place, lockdowns and others. And what happened was that some of the health facilities for children were repurposed, and as a result, facilities and human resources were used to address the plight of what became a disaster and a pandemic for adults mainly. Many countries' immunization programs were disrupted. And what are the reasons that are indicated? The reasons include depletion of stockpiles of vaccines and also vaccine supplies, which are put as vaccine supplies and are not disaggregated in terms of what exactly was contained in there. And what we find also is that there is an interlink connection between COVID-19 and climate change, in the sense that the pandemic set on after COP 2022. And what happened as a result, governments had to postpone their commitments to the climate change agenda. So that is important. And it says that we need to be thinking in terms of how the issues of climate and issues of pandemics need to be considered together and not be divorced from one another. And routine immunization programs were severely disrupted in similar ways that climate-related disasters would affect provision of immunization programs, but in a more prolonged way, which may have not been experienced in the context of disasters. Our method is a multidisciplinary team, and what we have done is to conduct systematic search of literature, and we came up with a narrative review. And we were looking at themes that emerged from the literature based on the searches that we did around routine immunization, vaccines, children, and vaccination, sociology of futures, climate, and also COVID-19. So these are the syringes that become the main issue here. And why are they the main issue? We are talking about autodizable syringes, and these are syringes that you cannot reuse. They are part of the program to control infection and transmission of infectious diseases, particularly those that pass to children through vertical transmission, most of the time from mothers to children. And we know that this is a big project and intervention by the World Health Organization. It works with people and governments and civil society to deliver this. But there are inequities that characterize manufacturing and distribution of these syringes. In Africa, until 2023, there was no WHO-approved manufacturer of autodizable syringes. And as a result, the continent depended on imports through the system that has been developed by UNICEF to get the syringes, while the vaccines will probably most be provided through the Gavi system. And there was concern that health systems in low resource settings would be severely constrained during the COVID problem. And this was coming from global health partners, Gavi, PATH, and others, that there was going to be a problem, especially when the vaccine programs and campaigns for COVID-19 gained momentum. There was going to be a problem, and most countries will not be able to provide for vaccination for their children. And this is the bigger context within which we need to understand syringes and their application and usefulness in the provision of routine immunization for children. And now we're talking about what is emerging from the literature in our narrative analysis. We find that in sub-Saharan Africa, only autodisable syringes can be used. And that is because of the epidemiologic context in which we live, where HIV/AIDS and also hepatitis B are endemic. These are problems that we need to navigate using our health systems, and part of that navigation entails using autodisable syringes. And what happened during COVID-19? There was this development. We have access to vaccines. The world has access to vaccines. And coincidentally, these vaccines were going to be vaccinated among adults, and they were going to use a specific autodisable syringe, which is a 0.05 milliliter autodisable syringe. And that syringe is the one that is also used with children. Most of the vaccines that are used to immunize children use this particular syringe. And our analysis of the literature finds that of all the reasons, the factors that have been identified, there is nowhere where it's mentioned that syringes were going to be a problem for effecting implementation of routine immunization for children. Those who are responsible for global health were concerned about the low rate of manufacturing syringes, but they were concerned at that time mainly because their worry was that the vaccine for COVID-19 was going to be affected. So we can say that there was competition. There was competition between providing for children and saving the lives of parents, which should have been an ethical concern for those who are responsible for making decisions. So we find that if we are to think of how effectively we can immunize children, we need to think in terms of those vaccines that are administered using the autodisable syringe and those that do not use it. And it's only 3 of them that do not use the autodisable syringes. The rest use autodisable syringes. There is one BCG that is given at birth, and we know the value of that vaccine, that it supports the immune system of newborns from that early stage. And it is, in that context, the syringe that is used, the 0.05 ml, is a different kind of syringe that we are talking about, which we say, as a result of the burden that was arising from providing for vaccination of adults in the context of COVID-19, there was shortage of supply of the 0.5 ml syringe, and this is the syringe that is used, then became important for delivering vaccines for adults, while countries still have to run routine immunization programs. Clearly there is a clash there, and we don't see in the literature either the global partners such as UNICEF, WHO, and Gavi are accepting that this was one of the problems, or identifying this factor as having contributed to under-immunization and zero-immunization that emerges at the end of the pandemic. What we find is that all other factors are mentioned, including parents' fear to have children or themselves contaminated by the pandemic, and not necessarily indicating that there was this huge demand for the same syringe that is not manufactured in Africa, or at least until 2023 was not manufactured in Africa, but outside, that had to be transported by sea to get to the continent, while vaccines are taken in the air. And that is a problem, because when you look at that menu of vaccines that children have to receive before they turn 2 years, before their second birthday, we realize that there is a lot of them that require to be administered using the syringe, this particular syringe, the 0.5 ml syringe. It's a lot, and we know what it means for any one of those vaccines to be skipped, to be missed, to be delayed. But this was a real problem. So it is important that we understand that during this time, during the crisis, during the health disaster, there were organizations that were making decisions about availability of vaccines. They were also making decisions about vaccination, and we understand that vaccines were not enough to be available, that vaccination would only happen in the presence of a syringe, and a specific syringe that is considered appropriate. When solutions came for COVID-19 in the form of pharmaceutical interventions that we had, we were celebrating, but we were blind to the fact that there was a population that was going to be negatively affected by solutions to this disaster. What it means is that there was no child-centered approach to finding solutions to the pandemic, and perhaps we were encouraged by the fact that initial studies had already cleared children. The initial studies had already indicated that children were not susceptible to the infection by COVID-19 the same way adults were. But in a way, this was misleading the world, because we only came up with reasons why there were delays in the delivery of vaccines, which were not so similar to other times in the past where countries were found to have not met their immunization targets. There were disaster-specific reasons. There were pandemic-specific reasons that contributed to delay, to zero immunization, to under-immunization of children, and at the center of that is autodizable syringes, the 0.5 ml autodizable syringe, and future research needs to take this into account. Thank you very much, colleagues.
Thank you, Dr. McCoy. Very different perspective, but very interlinked. Issue of climate change is interlinked with our entire life. Your bank account can easily move from somewhere to zero because of this. So it's interlinked. So your health can become a challenge just because of climate change. I just want to allow 2 questions. Yes, Prof. Can someone assist with the microphone here?
Thank you very much for a very interesting presentation. And I think it's very important that you are delving something which is very ignored at the continent, climate change and public health. So in your knowledge, what are the diseases which are going to be more serious under climate change, whether they are infections from vector-borne diseases or other things? What's your take on that one? Thank you.
Thank you very much, Prof. Thanks, Prof, and thank you for the question. Yes, the intricacies between public health and climate change. And when we think of the environment as air, as we heard this morning, as water, as land, and we think of the environment as also relational, we then recognize that going forward with ecosystems being forced to be in imbalance, we are likely to encounter public health issues that are primarily driven by deficiencies and malfunctions in our ecosystems. If we think of water and water pollution, for example, I'm talking from the perspective of children. Diarrheal diseases become a big problem. And if we are in this era where we have gone through a serious pandemic, but we have not immunized children sufficiently, rotavirus is not injected with a needle, it comes in the form of drops. But we find that we didn't do better even with that one. We didn't do better with the polio infection control vaccine. We didn't do better. So we are going forward and we are going to be troubled by diseases that come as a result of antimicrobial shifts that we are experiencing. We are also going to encounter diseases that come as a result of not having quality water. We are also going to have diseases that come as a result of general susceptibility that has come and arose from the fact that we are not adequately immunized as populations.
Thank you very much, Prof. Doc. Any other question? Okay, I think I don't see a hand. I think for the sake of time, I would like to call Prof. Debois to come. Let's clap for. It's this one. It's this one. So you can, yeah, you can change here. You can point.
Is it for the next?
Yeah, for next. Going back.
No, not back. Pointer.
Pointer is this one. Laser.
This
Yeah.
laser.
Yeah.
Thank you.
Yeah.
Thank you very much.
Let's just make sure that this is working. I don't know if it will show only it's there, but it's not so clear. You can see it.
It's not working?
It's there.
Oh,
It's
yeah.
not so clear.
But it's fine.
Yeah, okay.
Thank you.
Thank you for being patient.
Thank you very much. Good morning, everyone. My name is Jilali Banwar from the University of Science and Technology. in Algeria. I am a civil engineer. This is the first time I speak before social scientists. Yes, because we are, as we are engineers, we are funny. When we see numbers, we are happy. But today I'm going to present this indigenous knowledge where the word indigenous is not accepted in North Africa. Because for decolonization, during decolonization, they called us indigenous people. Then I put this indigenous for you, for sub-Saharan Africa. In North Africa, we don't accept it. We put traditional. We are not indigenous people anymore. It's finished. We are decolonized. Then we call that traditional from the people. Then traditional knowledge in earthquake risk reduction in the Kasbah of Algiers. Of course, many theses are done by sociologists and anthropologists. But the first time we asked the question, why this city, which was built in 16th century, in a seismic active zone, is still existing now when people are still living and visiting the sites. We just asked why. How come? In 16th century, there were no science like now and technology. Now we're asking questions. With the modern buildings, they are falling in earthquakes, and we're asking, is it the science where is failing, or is it the administration, let's say, management? Because now I'm going to show just the technical things, but I'm sure there are other traditional knowledge in the management, in the organization of the society. And all these, I'm not going to show them, but I'm going to show just the technical thing which prevent this earthquake risk in that time. This is the Kasbah of Algiers. This is the capital of Algeria in the 18th century, 17th century. This one, it was built like in houses, like Mediterranean construction, like villas, separated villas in Algiers. Then when came the earthquake, it destroyed all the villas. Then the new thinking, which we call local seismic culture, and this is the first case for us as University of Village. The same, because at that time there was no university's knowledge for this technique. No, this is from the village, which one I'm going to show you. Then this is the early time of the city of Algiers. Then there was this earthquake in 1716, which we caused like 20,000 people died, and many more injured. Seismic resistance technique concerning the following aspects were implemented. The urban scale, we have the architecture scale, and we have the structural scale. Then these preventive measures were not in just one thing. They were on the whole urban scale and the architecture scale, how the architecture at that time was thought by the occupants of the Kasbah, and also the structural scale, which means everything which is like bearing walls, like foundation, like slabs, and everything. This is on the urban scale. See, look at the blocks of the construction. Varying number of houses are individualized by communication street, which surround them, very narrow street. This makes each block react independently from the other things, the shaking. What they do is that, because we see that these blocks, these houses within the blocks, when they have a release of energy by earthquakes, it's not one building who will absorb the energy. The energy is distributed to the block. Then each construction will absorb a certain amount of energy that's in the urban scale, where it takes some energy. The houses are semi-detached, not detached completely. All the houses are all together, making like a tissue of the overlapping. Houses are overlapping each other and leaning against each other, forming a compact, homogeneous unit. Homogeneous unit. That is, all the energy released in that site will be distributed to all the houses. Then each house will take a certain amount of energy released. Then our thought is, the thinking of this time was the energy. They knew that earthquakes release energy. Then the problem is that how to absorb energy. If you cannot absorb it, it will destroy the constructions. The Sabbat, here you can see the Sabbat. This is what the picture on the right. This is Sabbat. See the streets. Just to tell you, there is no problem of flooding, never problem of climate change. Not even extreme events, extreme temperature, cold or heat. They don't need heater, and they don't need, until now, people living there, because look, the streets are covered. All the city is covered. When you go inside, in summer, it's fresh. When you go inside, in winter, it's hot, it's good. See, then there is no problem. But for each of that, it's multi-hazard construction. It's not just for earthquakes, just to talk about earthquake today. The Sabbat, see this picture in the right, the number of streets are covered by galleries, on top of which the houses extends at the first floor, and those creating a roofed passageway or the street. They can be flat, or they with wooden locks incorporated in vaults, built of stones or bricks. These techniques of vaults, this technique of vaults, this is to transfer the energy from one side to another side, just to transfer the energy from this side to the other side by this vault. All the Casbah is with vaults. This, what we call them, discharging arches. They discharge in the horizontal, they equilibrate the horizontal charges generated by earthquakes. In urban framework, number of arches built out of stones or bricks allow transfer of horizontal loads up to the ground. This is the technique of the arches. They transform the lateral loads into vertical loads, and they transfer it to the foundation to the resist. And by the way, we made some survey about the Casbah by the technique of vibration, and the foundation are all rocks. All these people, they built this Casbah on the rocks, where there is no amplification of earthquakes forces. If you build that on alluvions, you will be problems of amplification. And that's all these ideas. Now we know. Now this is what we are doing in earthquake engineering and dynamics of structures. Construction are not isolated elements, but compact dynamic blocks. See, this is dynamic blocks working together during earthquakes, absorbing together the energy released by earthquakes. This is how it looks. This is how the Casbah is built. If you go under the Casbah, you see these tunnels and with arches. This is which make the Casbah strong by its foundation. This is the Casbah here. Then reading construction technique, but you have to be an architect or engineer to read the construction technique. If not, you cannot see anything. You cannot see these techniques inside the Kasbah. Reading construction technique were unfortunately facilitated now by the state of degradation. They are trying to reinforce that it was easy for us to see all these what we call anomalies that protected the Kasbah for 5, 6 centuries. State of degradation which is predominant now in the minor heritage, the houses. Then we can see what is in the walls, in the foundation, in the roofs. The structure of masonry construction is divided into 4 parts. The vertical structures, load-bearing walls, the walls, load-bearing walls. Instead of now we use columns and arches. The horizontal structure, then we have walls and the horizontal structure, the floors and roofs. This is the horizontal structure which will resist the horizontal loads generated by earthquakes. The different crossing, like doors, windows, stairs, nothing is left to hazard. Everything is taken. It looks like this is like a good university. Yeah. The architectural element, the overhangs. In the architectural scale, typology of houses, most of them have a central patio in the center, and the houses are built, around the houses. Patio of square form, around which the rooms are distributed 2 or 3 levels. This square form now, by earthquake engineering and dynamic infrastructure, we know that the best form to resist earthquakes, to avoid torsion of the buildings, is a square of circular. These people build their houses squares. Then the best form to resist an earthquake, because they are squares, they are symmetric, then there is no likelihood of torsion, which destroy the buildings. Shape of houses, square form, the shape of the houses of the square being the most earthquake resistant today. We know that by laboratories and reality, by controlling the buildings during earthquakes, putting some GPS thing, and we know that the best forms to resist is the square or the circular. Description of structure. Reading construction technique facilitated, unfortunately, by the state of degradation, which is predominant now in minor heritage. The structure of masonry, no, I think, wait. Oh, yes. Look at these walls. What we found, that's why I said you need to be architect or engineers to read, to be able to read the techniques. If you look here, this is a separating wall. No, here. The first picture, you can see the wall, that is separating wall, with some woods in the corner. See? And they are equidistant, like about 50 centimeters. We thought, what these woods are doing into the walls. But when we took them to the laboratory to show people who didn't believe in this traditional technique that they are earthquake resistant, we put them on a shaking table in the lab. And the friction between the 2 different materials, the wood and the bricks or the rocks, the friction absorb energy. Absorb the energy, some part of the energy of the energy released by earthquakes. See, all this wood will absorb energy. Then we saw that in the lab. And if you see also the floor, you can see the floor. We found floors like 80 centimeters. Oh, 80 centimeters. Why? we couldn't understand, we see that. But now, earthquake engineering, in the advancement of earthquake engineering, the first assumption is that the floor should be infinitely rigid, infinitely rigid. To be rigid at that time, it has to be, because there is rocks inside and sand and everything, to make it as rigid as possible. And today, this is the first assumption in dynamic of structure, earthquake engineering, that if the diaphragm of the floor is semi-rigid, it means if it is rigid, it doesn't make any deformation. Then the lateral load coming from this side or this side will transmit the force of earthquakes through the infinitely rigid diaphragm to the other side and to hold the Casbah. Yes, and that's why they have these big floors to transfer the lateral loads transmitted by earthquakes. And you can see here too the same thing. These woods, and this is what we took to the lab. We rebuilt these walls. In one time, we removed these woods, and another thing, we put the woods and put them in the shaking table and see the resistance of each one of them. Then we concluded that this is, and they are applying these woods, you can see them, in this bearing wall because of the friction of the wood and the bricks. Same thing in the third thing. Here you can see the floors built by superposition of 2 layers of cedar woods. They're still there. Now, these cedar woods, we can see them in the Casbah. They are there. 2 layers of cedar logs inserted in all width-bearing walls, rigid diaphragm, about 80 centimeters thick. This is what I said, the infinitely rigid diaphragm to transmit the charges. Core billings. Look at these core billings in the Casbah. Here you can see the drawing, and here you see the real picture. Up here, we can see the real picture. And here for the engineers. To read for the engineers. If you can see the up picture to the left, you can see the floor. Here you can see the floor. If you can see this technique of the core billing, it's amazing. It's amazing how these people thought about this core billing. This balcony. Here you can see, no, I cannot show that. Anyway, here. Oh, sorry. We can see here from the people here, which is free. And here, fixed. Why? Because at that time, even these people at that time, they knew about the component of the earthquakes. There are 3 components. There are east-west component, north-south component, and the vertical component. If they didn't meet this technique, they left it free, like this, free. Then when the earthquake, the vertical component would do that, it's free here. If it was fixed, it would destroy the building. But they left it free. This technique is amazing. Oh. Yeah. We can see the corbinic frontal balcony overhanging a supported cedar wood, logs forming an angle with the bearing wall. And you can see these woods here. The woods in the floor, they were going, like more than 1 meter, almost 2 meters outside the buildings. Why? Why they did that? I don't know if by experience or by understanding, by vision, because the woods, they were making the floor if they were put just on the walls, I mean in the thickness of the wall, during vibration, during earthquakes, if the vibration were in phase, the walls, they're going in phase, that's good. But nothing happened. But in case where we call a dephasage, like this, the floors will fall down. Then they took these distances outside the walls, even if the walls vibrate or oscillate like this, there is no fall of the floors. Look also this. It's incredible, these local people, this traditional. Look at this wood here on the arch here, on the right. Now we know that if you have two structures with different rigidity, when there is an earthquake, they will vibrate, but not at the same rate. If they don't vibrate at the same rate, the upper part and the lower part, there will be destruction because they don't vibrate at the same, they don't go to the same distance, vibration. That what you need is put some woods there to equilibrate this vibration and absorb the energy, some parts of the energy released by earthquakes. See? And we can see them here in the picture in the right. And these people, this structure are different rigidity. Now, in earthquake engineering, we apply that. We do some techniques now. We have modern techniques to put on the building to absorb the seismic energy. Another thing we found, we couldn't believe that at that time, in 1700, they knew what is seismic base isolation. What does it mean? It means they isolate the building from the soil, because earthquakes, they vibrate the soil. But if you isolate the building from the soil, the isolation technique, what will they do? They absorb energy. What we found, because they are doing some works, look, under the foundation they put some woods, cedar woods. How? Cedar woods. Then you see the foundation is isolated from the ground. When they have earthquakes with the weight of the building and the soil, you have in between, you have these cedar woods. And you have the rolling of the two structures, the soil and the building. And this technique, I don't know how they thought about it. But now we use in earthquake countries like hospitals and mosques and stadiums, and because there are a lot of people, they go there. We use this technique not with woods, but with modern seismic isolation devices. We are using it now. Then you see how these people, they were advanced in technology. But people didn't believe until we made them on the lab, on the shaking table, and when we put real earthquakes, and to see the behavior of this construction in the Casbah of Algiers. Then, now they are convinced. But they said, okay, no, we said we should adapt these things. We should make research, not to lose these techniques. These techniques can be exported to many countries in the world, because they are tested for 5 centuries in really seismic active zones. See, this is a project of European 11 European universities and University of Science and Technology in Algiers. When I visited the mosque, which was built in 1907 in Algiers, there was a question, how come this mosque resisted the earthquakes It should be something like the Kasbah, because it is within the Kasbah, the mosque. And they said, something is different. Something we have to look what is different in structure to try. These people from Europe, what they found is this arch. They said, this arch, we don't have it in Europe, with double curvature, double. One like this, and one like this, in the two direction of earthquakes. Oh, they said, okay. Then we draw it, and they rebuilt it here. We took it to Rome, on the shaking table of Rome. Here. Yes, to show that the mosque, which was built in 1907, is resisting the earthquakes even now because of this arch. Then we took it, you can see here how every point of the arch was with the camera and the thermic camera and everything. This is, in the right, you see the inside the mosque with the arches. And we put it on the shaking table on the, in Rome. I don't know if the video is working. Try the video, please. Try the video, if it's working. Oh, no, this. No.
But we are running out of time. May I
It's not working.
to move? We do still have our virtual sessions, and we're running
It's not working with the video.
an hour over.
Okay, next.
A half an hour over. May I please ask
Then
that we
conclusion,
proceed
recommendation,
as swiftly as
this one is
possible?
underlined.
Just
The
watching the
relevance of
time that we
traditional
still have
seismic
2 presentations to be done.
resistant knowledge,
Thank
and
you.
discovering and adapting these indigenous techniques can strengthen contemporary efforts to preserve and rehabilitate historic urban fabrics such as the Kasbah of Algiers, a UNESCO World Heritage Site, and of the Maghreb, Medina. There are many Medina like that in the Maghreb. The recommendation emphasizes the need to integrate traditional earthquake-resistant technique such as timber reinforcement, linking the masonry to floor system into modern restoration standards and building a regular heritage inside. You know, these people and their philosophy of resisting earthquakes were not talking about earthquakes, because earthquakes, they never killed anybody. Earthquakes, they never killed anybody. Then human, they're designing their own disasters. Construction, the civil society. Then I was surprised that during the 2 days with social scientists exposing their research, not even a word of vulnerability was said. Not vulnerabilities in reality, not vulnerability, vulnerabilities, physical and social vulnerabilities. Because the problem may be created not only by the physical vulnerability, but by social vulnerability. And this is very important because you have the vulnerability maybe of the administration, error of administration, maybe vulnerability of organization, maybe vulnerability of the management system. All these vulnerabilities should be taken into account, not the hazard, not the natural hazard, not the natural phenomena, because people, civil society, by their ignorance or their negligence, may create this disaster. And we said we design our disasters by ourselves. All the disasters, whatever they are designed by human. That's why social sciences and humanities are very, very important in disasters, not engineers. Engineers, they believe they can resist these earthquakes by this small, what we do today. But earthquakes, you know, magnitude 4, it's like an atomic bomb of Yokohama. Yokohama. How we can make resistance of energy released by an atomic bomb of magnitude 4, that's all. I'm not talking about 8, 7. Then, thank you very much for your attention. Thank you.
Thank you very much, Prof. I was just thinking that maybe we need to have a public lecture before you leave Namibia. So, yeah, because of time, I'm only going to allow 2 brief questions. I know we are out of time, but we also need to hear. Yeah, no, it's fine. We also need to compensate you for postponing your presentation. Yeah.
Thank you, Mike. Actually, this is very interesting. The one comment, short comments, then question, short question as well. So, indigenous word is very hybrid. It's changed according to land and community, and it has hybrid meaning, right? So, the issue that you shared is so sustainable for thousands of years. The problem is now, whatever infrastructure we are talking is became profit, industrial profit. So that's why they are not recognizing the traditional long-term sustainable because they do not see profit on it. The same thing, COVID-19, we saw it. They found, the couple of companies found the solution, but they don't want to share because it's a profit. And that's why they don't want to profit. In land-based culture, it was open for all, sharing, learning from each other. But once it became a profit, in capitalist society, everything became the own property. That's why that they don't want to recognize it's a political, intentional, and disaster by choice. That's why disaster is happening by human created. And disaster is not new. It's for thousands years. People survive it. So why people are getting so many people are died? Because it's created in a way that people can make a profit. Sorry, it was comments.
Thank you.
Yeah, I would allow you, Prof.
No, it's just a comment. I think that one of the questions that I was keeping was this idea of whether earthquakes are a natural disaster. I think in a very good way, you've, in a sense, debunked it by looking at the vulnerabilities, the physical and the social. And I think that the fact that those communities survived many years, but they were able to adapt and build structures that responded, I think you brought my, how can I say, and now I can, believe when people say it's not natural. It's just a comment, it's not a question.
Thank you, but you said the first word, which I don't accept. The first one, there is no such thing called natural disasters. I said all the disasters are made by human. Then there is no such thing called natural, there is no natural disasters. No. Disaster of natural origin. But human is there. Human is there always. Then we have to teach, or not to teach, to shift the paradigm, not concentrating as we are doing now on the hazard, but we should concentrate on the vulnerabilities. If we teach our societies about the vulnerabilities, we reduce earthquake. Because you cannot reduce the hazard. The hazard is natural. The hazard is from God, but disasters from a human. We don't have to mix. Because if you said natural disaster, it means from God.
No, I'm with you. That's what I'm saying.
Thank you. I feel like, overpowered I have to admit, overpowered the chair. I think because of time, I need to reclaim my power. Please, I think we'll engage with the prof later. So for the sake of time, I need to ask the next presenter. Thank you. Thank you very much, Prof. The next presenter, can I get confirmation whether Juliet Linokunda is online? Juliet?
Yes, thank you. I'm here.
Please share your presentation and go ahead. Juliet will be presenting about developing a framework for integrating climate resilience into urban sustainability at Mutapa Open Market in Gweru, Zimbabwe. Please go ahead.
Okay, so I'm trying to share my presentation. Hello, can someone help me with sharing my presentation?
The technical colleagues, do you have the presentation? Okay, they seem they don't have it. While you are getting ready, I would like to know whether Dr. Maposa, no, sorry, Dr. Maposa, is that correct? Is ready?
Yes, I'm there online.
Please go ahead and share your presentation.
Thank you. Let me try and share.
While you are busy, can I get confirmation whether Elizabeth Kambonde is here? Is not here. Okay.
Okay.
Elizabeth, are you online? Okay. Yeah, just go ahead, Dr. Maposa, to share your presentation.
Okay, I'm trying to.
Prof,
Hello?
I have Juliet's ready. This is Khadija Khan. I have Juliet's ready to be flagged, if you can hear me.
Sorry, may you say that again?
I am Khadija Khan. I do have Juliet's presentation for flagging if she's ready. I can share on my side.
Yeah, please go ahead and share it.
Okay, will do. It's sharing. Just allow me 1 second. Okay, over to you, Juliet.
Okay, thank you so much, ma'am. Am I audible?
Yes, Juliet, go ahead. We can hear you.
Okay, thank you. So, hello, everyone. My name is Juliet Shidoshashe Runokunda, and I'm an MPhil student at Midland State University in Zimbabwe. So, I'll be presenting my paper titled Developing a Framework for Integrating Climate Resilience into the Sustainability of Gweru's Mtapa Open Market. So, the co-authors, that's myself and Professor Mark Mata from Midland State University. Next slide, please. So I'll start with the big picture. So open markets, these are the lifeblood of urban economies, yet they are increasingly vulnerable to the impacts of climate change. So on this research, we were focusing on how can Gweru's Mtapa Open Market enhance its climate resilience while promoting market sustainability. So that's a picture of the Mtapa Open Market during the rainy season. Yeah, we can see the muddy conditions and the stores that are not well structured. Can we have the next slide, please? So the research objectives are to analyze the sustainability challenges hindering climate resilience at the market and to develop a framework for integrating climate resilience into the market sustainability at Mtapa Open Market in Gweru, Zimbabwe. Can we move to the next slide? For the background of the study, open markets Some call them open air markets, farmers markets, or vegetable markets. They serve as vibrant hubs, providing a free and accessible platform for buyers and sellers to congregate whilst they sell their merchandise with minimum barriers or restrictions. So I also defined climate resilience, which is the ability of individuals and communities to endure, manage, and recover from the effects of climate change. In this case, we are looking at the market traders at TAP Open Market. So, according to Beretta et al. 2017, these open markets are not exempted from the impacts of climate change, such as rising temperatures, changing precipitation patterns, and the likes. We have examples in developing countries like United Kingdom, France, and Spain, where open markets are well structured to reduce the vulnerability of traders to flooding and intense solar heat. Examples of some of those markets in developing countries include the Grand Bazaar in Istanbul, the Camden Market in London, the Taladai Market in Thailand. Can we move to the next slide? So, according to Deity et al., climate change disproportionately affects the livelihoods of women engaged in the informal vending sector in India. We can also see that in southern Ecuador, climate change has impacted the food systems, which affects the livelihoods of the traders in that region. We also have examples in developing countries like the Kumasi Kiejetia market in Ghana, the Haradi Dawa market in Ethiopia, Soweto market in Zambia. In Zimbabwe, we have the Mbare Musika and also the Gweru Mtapa open market. So the current state of the Mtapa open market exposes traders and their merchandise to the vicissitudes of weather, including strong winds and rain, and also intense solar heat, from taking this to the picture that I showed you on my first slide. So given its economic relevance and impact to the livelihoods of traders, it is important to enhance climate resilience through sustainable market interventions. Next slide. So for the research methodology, this study utilized a descriptive case study design, which triangulated qualitative and quantitative approaches. So for the quantitative research approaches, we had closed-ended questionnaires that were administered, self-administered in the study area. So for the qualitative approaches, we had interviews with key informants, which included the district environmental officer from the Environmental Management Agency, known as EMA, and the Gweru City Council official, housing official, and we also had the Mtapa Open Market Vendors Association, a representative from the market, from the vendors. For quantitative data analysis, we used SPSS, descriptive statistics, and also qualitative data, which utilized thematic analysis. So all this led us to the triangulation of results, which were used in the developing of a framework to integrate climate resilience into the sustainability of Mtapa's Gweru Mtapa Open Market. Next slide, please. So our results, the study from the field observations, we came up with a problem map which shows the existing sustainability challenges at Mtapa Open Market. So that part in yellow, that's the market. And I don't know if the pictures are visible, but the pictures show the challenges that are that are existing currently at the market. So we have muddy conditions during the rainy season. We can see the vendors encroaching into the main road, causing congestion. We can see that there are poor poorly designed vending stalls at the market, which exposes the traders to the vicissitudes of weather, as I had mentioned earlier. We also have the market is also located in a wetland environment, and there's also a stream nearby. As we can see from that picture, we have the river source being polluted by the litter that comes from the market. We also have the market is located adjacent to a graveyard, Tapa Cemetery, and you can see, I don't know if it's visible, but there are the proliferation of illegal dump sites within the graveyard. And we also see that there are illegal structures that are being used by traders who spend the night at the market, among other challenges that are on the problem MIP as shown. Can we move on to the next slide? So the results also indicated that adverse patterns promote operational challenges as seasons change, whereby the majority of the respondents indicated that the rainy period occurring from November to March posed significant challenges to their vending operations, followed by the hot period. As you can see that they have inadequate infrastructure that protects them from the hot period, and we also have the cold period from May to August, which also affects the operational challenges as mentioned by the respondents from the market. Next slide. So we also got to ask the vendors if they are aware of the climate change impacts that affect their operations. So 94% of the traders reported that they lacked awareness in the impacts of climate change on their daily operations. And the Gweri City Council Housing and Community Services Officer remarked that we need to equip traders with knowledge to understand how climate change affects businesses, because without this knowledge, they risk losing profits, which affects their livelihoods. So from the results, we realized that most of these traders, they really do not have knowledge on what exactly is climate change and how does it affect their daily operations at the market. Next slide, please. Okay, so figure 4 shows a map of Zimbabwe and the source regions from which the vendors get their merchandise. So the traders indicated that they get their merchandises from South Africa, from Botswana, and also from Zambia. And this includes second-hand clothing, new clothes, and also groceries. But within Zimbabwe now, most of the traders indicated that they source their goods from the eastern highlands of Zimbabwe, which include the Chirezi, Mutare, and Honde Valley part. And also, they also get some of their merchandise within the Gweru, the Midlands province, where Gweru is located. And these are the farms within the area. So can we move on to the next slide? Okay, so now we'll move on to the discussion section, whereby we realize that in developing countries, over 80% of informal vendors operate in open markets, which face dire climate challenges. So the findings from our study highlight the significant impact of climate change on the sustainability of the market, which exposes the traders to operational challenges, as we have indicated. So the traders operate unknowingly within this climatic shocks and stresses, mainly due to lack of awareness and on climate change impacts among them. So sustainability challenges therefore continue to exist within the market area due to lack of planning, inadequate mechanism to evaluate the performance, and also weak coordinations from the regulatory board, be it the local authority or the government itself. And also insufficient financial resources allocated for market improvement. As we all know that these markets, these open markets, no one really prioritizes their development, and people just operate in a chaotic and haphazard environment, which also exposes them to various, which exacerbates their vulnerability to climate change. So by recognizing urban markets as integral components of sustainable urban development, we not only address the economic and social needs, but also enhance the long-term resilience for cities like Gweru amidst climate change challenges. So this research developed a framework which can be used to integrate market sustainability into the development and climate resilience of the market, as shown in figure 8 below. Can we move on to figure 8? So this figure shows that for us to attain climate resilience at the market, there is need for us to engage with relevant stakeholders from national to local levels. So we have the Ministry of Environment, Climate, and we also have the Environmental Management Agency, which is under that ministry. We have NGOs and Ministry of Women Affairs and Community, Small and Medium Enterprises Development. We also have the Gweru City Council and Mtapa Vendors Association, which represents all the vendors at the market. So the framework here outlines the roles of each and every stakeholder and how they will aid into the achievement of a sustainable climate resilience at Mtapa Open Market. So the Ministry of Environment will support stakeholder participatory approaches and inclusive decision-making, and they also oversee the national policies and policy formulation towards climate change and urban sustainability. So this ministry will help, therefore, to come up with policies that include the needs of the traders at the market, so that they will also have attain climate resilience. The Environmental Management Agency will also help in research and innovation on climate practices, and also offer educational trainings and awarenesses to the vendors at the market, because normally this agency, they go to the market and engage with traders doing cleanup campaigns, and I feel like and we have NGOs which will also facilitate in knowledge sharing. The Ministry of Women Affairs will help in skills development, finance, and promoting social inclusion. The Gweru City Council now is the responsible authority, so that will help in improving the infrastructure and also market evaluations and monitoring when the project has been completed. And the vendors now, as they represent the association, as they represent other vendors, they also help in advocating the needs and concerns in urban planning and climate resilience initiatives. Can we move on to the next slide?
Juliet, try to summarize very quickly.
Okay, so I'm now at the conclusion. whereby the integration of climate change, climate resilience at Mtapa Open Market represents a transformative opportunity for Gweri to cultivate an inclusive and sustainable urban environment. So when we integrate climate resilience into the sustainability of the market to support these vendors, we therefore contribute to the attainment of several sustainable development goals like SDG 11, sustainable cities, 8, decent work and economic growth, and also sustainable development on 13 on climate action, whereby we are taking urgent measures against climate change. Can we move on to the next slide? So this is just the acknowledgement section where I just acknowledge my co-authors and the university for its support. Thank you so much for this opportunity.
Thank you very much. While I will allow one comment or question, please, my Dr. Maposa already started loading the presentation. Just one question or comment. Online, do you have any question or comment? Those of us who are online? Okay, it seems no question, no comment. Dr. Maposa, please go ahead. Try to move a bit fast. Things like literature review, and try to skip those ones. Are you there?
Good up.
Dr. Maposa, please.
Yes, good afternoon, everyone. My name is Mandlenkos Maposa, and I did this work with Dr. Kaplan Efoso and Professor Pilani Moyo. And there is the title of our presentation. Can we move on to the next page? Can we skip that slide? Yes, I basically want to talk about climate injustice. I think borrowing from what the keynote speaker said in the morning about looking at environmental justice, not just as an issue of looking at land and injustices in terms of accessing land, water, and so forth, but going beyond to look at issues of relational injustice. So there we have a picture where we have on the left a game reserve, and on the right we have a surrounding community. So these are communities that are living side by side, and we want to basically understand how is it that they are affected by climate change, and how is it that they adapt to climate change. So again, that's another picture showing the same. We can move on in the interest of time. So it is an acknowledged fact, as we have already heard all morning, that climate change is causing havoc in socio-ecological systems in Southern Africa. And this, amongst others, includes biodiversity loss, food insecurity challenges, and resource conflicts. And maybe as a big picture, between 1970 and 2020, approximately 73%, that is of monitored, we underline the word monitored vertebrate species, were lost. And this is an alarming statistic, especially for Africa, given that approximately 62% of the rural population directly depends on ecosystem-based resources to ensure food, water, energy, and health security. Let's move on. Coming closer to the study context, South Africa is one of the world's 17 mega diverse countries, and it hosts substantial biodiversity-dependent economic sectors. As an example, in terms of employment, it is estimated that it generates close to 500,000 jobs. And in terms of tourism revenues, it rakes in around 31 billion rands. And in this context, it is unfortunate that the country is grappling with extreme inequality, unresolved land reform processes, and highly vulnerable rural populations, amongst others, especially in our case study of the Eastern Cape. Let's move on. So what we see is that in terms of existing knowledge, there is a tendency to focus on ecological and economic analysis of conservation, such as biodiversity loss, tourism revenues, or management efficiency. And we pay little regard for how conservation processes intersect with social inequities and climate vulnerability. And as such, in this presentation or in this research, we sought to ask how the expansion of and governance of private conservation areas in the Eastern Cape intersected with climate risks and historical social inequities to produce and reproduce environmental and climate injustices for local communities. So we can move on. So the tendency is when we look at climate justice, we tend to look at them from the perspective of the global north versus the global south. But even within the context of the global south, there are these climate injustice challenges, as we are going to show. So in terms of the analytical framework, we are leveraging on the political ecology framework, which helped us to analyze the uneven distribution of costs and benefits, and which also put a spotlight on how the existing arrangement reinforce existing inequalities. We also looked at environmental justice as a conceptual lens, and the issue of equity, focusing on distributional, procedural, and recognitional dimensions. Let's move on. In terms of our methods, this was a qualitative study as we sought to gain in-depth insights into the participants' lived experiences, that is those from the game reserve and the communities surrounding those game reserves. And we were looking at the Makana local municipality in the Eastern Cape in South Africa, which is dogged by high poverty and unemployment levels, making it a critical case study for examining climate and environmental injustices. So Amakala Game Reserve is approximately 69 square kilometers in terms of its expanse, whereas Lalibela, which is one of the game reserves under study, is 62 square kilometers. And of note with those two game reserves is that Lalibela is engaged in what they are calling a substantial ecosystem reset initiative, where they are turning hitherto fruit farms. They were farming peaches and prunes, and they are turning those into game reserves. And whereas Amakala Game Reserve was constituted through combining 8 adjacent farms, previously livestock farms, into a single reserve. This was in response to a 6-year drought that dogged that area from 1989 to 1995. Let's move on in the interest of time. So what is it that we found in terms of the climate risks and vulnerabilities that the surrounding communities and the game reserves are facing? There are environmental stressors, particularly drought and erratic rainfall patterns, which are linked to increased difficulty in maintaining agricultural livelihoods and biodiversity. So there on that table, I'm showing some of the quotations that reflect on those key issues: water scarcity, agricultural disruption, and biodiversity loss. Let's move on. And then in terms of whether or not communities are benefiting from the establishment of these game reserves, Yes, there are indeed benefits in terms of employment, in terms of infrastructural projects that are rolled out, in terms of training opportunities that are availed to the communities. But as you can see from the table, the communities are not satisfied. So they feel marginalized and unsupported by these reserves, although they do acknowledge that there is some benefits that they are getting, but it is on a limited scale. Again, this speaks to issues of distributional injustices, as it were. Let's move on. And then access to natural resources and land. The establishment of these reserves partly involved some land dispossession, as these game reserve owners are procuring land, and hence what we are getting is that the poor are having limited access to land and natural resources, which remains a critical concern. And because of the nature of game reserves, where they exercise or they use fences and so forth, this then tends to limit farming, grazing, and access to other resources, including access to what they call ancestral graves, which has cultural implications, as it were. And then there is also unequal access to water, as reserves have greater access to water as compared to the surrounding communities, as you saw in that picture that I showed there earlier on. Let's move on. And then with respect to governance, we sought to find out whether communities were involved in any shape or form in terms of the governance of these reserves, because these are reserves that actually have some of the resources that the communities need. And what we found out is that as much as these reserves are assisting the communities, they are doing so without the full participation of the communities. So there is no representation. For instance, if there are foundations or boards, there are no representatives from the community members, and therefore decisions are made without meaningful community input. So there are no community reps on the boards. I've already highlighted that. And hence, what we then have at the end of the day is that whatever benefit sharing mechanisms are there, they are opaque. Communities don't understand how they get what they have, and how they don't get what maybe they need as communities. So this is exclusionary governance, and those quotations that are there on the table reflect on that. Thank you. Let's move on. So what we see is that the current conservation models, particularly within privately owned reserves, are experienced by many community members as exclusionary, with limited benefit sharing and minimal participation in governance processes. So private conservation perpetuates inequality and climate vulnerability. Access to critical resources such as land, water, and ancestral sites has been constrained, reinforcing historical patterns of marginalization. So our key message, therefore, is that we cannot look at conservation as something that is socially sustainable without addressing the underlying governance deficits and inequities in benefit and resource distribution. Last slide, please. So to maybe deal with some of these challenges, there is need to develop a framework that will formalize benefit sharing agreements that are legally enforceable, transparent, and subject to regular review. There is also need to consider establishing co-managed buffer zones or peripheries around reserves that permit controlled community grazing, subsistence farming, and resource collection, which can significantly mitigate livelihood impacts and reduce conflicts. And lastly, there is need to consider adopting co-management models that will promote shared authority and accountability in conservation planning and implementation, aligning with the spirit of programs like the People and Parks program in South Africa. I thank you.
Thank you very much for keeping in time. I just want to allow one comment or one question to you. Any question or comment? I don't see any hand. Those colleagues who are online, any question or comment? Okay, I think it's past lunch time. There was Everson Dolovu. I was advised that you belong to another afternoon slot. Yes, I think we will, at least I was advised that way. I think we will try to coordinate so that you are added on the afternoon. My advisor said on the other room, but yeah, I think as chair I will have to end here. We have to stop here and then we go for lunch. Thank you very much for your time. Very interesting presentation. I think we'll reconvene after lunch.